Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hi, we're back. I hope you're all well. Hope you're doing good and feeling fine this weekend. There's a new study that talked about a certain form of baldness in men at age 45 is linked to a higher risk of aggressive prostate cancer. It's a new study. It was just put out this week in the Journal of Clinical Oncology that showed that men with a specific kind of baldness at age 45 have a 40% increased risk of developing aggressive prostate cancer later in life compared to men with no baldness at age 45. So it's a large study. It's from the prospective prostate, lung, colorectal, and ovarian cancer screening trial, which indicates that men who've had moderate baldness affecting both the front and the crown of their head, the top of their head at age 45, were at a 40% increased risk of aggressive prostate cancer, indicating a faster growing cancer and a poor prognosis compared to men with no baldness. There was no link between other patterns of baldness and prostate cancer. It was published in Journal of Clinical Oncology, and it supports earlier research that male pattern baldness and prostate cancer might be linked. Why? Well, men with higher amounts of testosterone in their body may have more male pattern baldness, and that higher a level of testosterone or something else may be precipitating the cancer. Now, prostate cancer is the second most common cancer among men, and there's emerging evidence that prostate cancer and male pattern baldness, progressive scalp hair loss in a distinct pattern, are connected to increased levels of sex hormones and androgen receptors, supporting the idea of a biologic link between baldness and prostate cancer. And this is a study of about 39,000 men. So it's an interesting study, and every man should get checked out for prostate cancer. Now, I know there's controversy about who should be screened and not, but about 250,000 men get prostate cancer a year. About 70,000 die of prostate cancer a year, so it's taking many lives and affecting many families. And there's also studies in several Scandinavian countries that show that where there's more screening and treatment, the death rate from prostate cancer is less. So it isn't that treatment doesn't work. Maybe some insurance companies don't want to pay for it, or maybe the government may not want to pay for it, but prostate cancer is a big killer, and it affects many men, about 250,000 Americans each year. So give us a call if you have questions. Our number during the week for medical questions or other things is 212-CHOICES, which is 212-246-4237, 212-246-4237. And an easy way to remember is 212-CHOICES. This is Dr. Lederman. We work at 1384 Broadway. We're a private cancer treatment center. When a man came in with his brother this week, a 73-year-old man with 2 children, he was fine until 2010 when he was diagnosed with colon cancer. Now listen to this. He had colonoscopy. It showed an abnormal polyp, and the gastroenterologist didn't remove the polyp. Well, the whole point of colonoscopy is to find things, to remove them before they become cancers. Well, this patient went through colonoscopy. They found a polyp, and then the doctor said, "Oh, I'm not removing it." And the patient went back to him and said, "Please remove it." And the gastroenterologist said no. And then 2 years later, he comes down with an invasive cancer in the exact same spot. This is all in a neighboring state. So can you believe that? He had colonoscopy. He did everything right, and then was found to have a polyp, which was not removed. And then 2 years later, he had the stage 3 cancer, which means it was in the colon and in lymph nodes. Wow. And we know that people who have good colonoscopy, not every colonoscopy is perfect, and there's been other studies, and we've talked about it on this show, that the more time the gastroenterologist spends doing the colonoscopy, the more likely they are to find things. So this man now has metastatic cancer. He had a little stroke in July, but he's doing great. He came with his brother and his wife for consultation. He weighs 225 pounds. He's 5'10". He does not look sick, but he has stage 4 colon cancer, and he wishes to have treatment for the cancer that spread to the lungs, and that's work that we do. Body radiosurgery allows us to hit the cancer in the lungs or anywhere else. We're also going to check, because he's got some swelling of the ankles. No one else found it apparently, but we know that the number 2 killer of cancer patients is blood clots. So we're checking out his cancer, we're checking out his blood clots. Also, he had a mass in the pancreas that was seen by the testing, and no one told him about that. We told him about that. We gave him the report. We went over all the reports. So we're checking the pancreas, we're checking the lung, checking the legs, and trying to give him a thorough evaluation and thorough treatment of his metastatic colon cancer to his lungs. And we had a man who came in this week. He's a performance artist, a video artist with prostate cancer at a PSA 7.6, Gleason 6. So actually low-risk cancer. He's 70 years old. Other doctors elsewhere put him on hormonal treatments for 6 months, which he doesn't like because obviously it took away his sexual feelings, libido, and erections. Our success without hormones for someone like him is around 95%, so very high success rate for a low-risk prostate cancer, PSA 7.6, Gleason 6. He came to us. We gave him some medicines to get the blood flowing again to his penis because the hormones take it away and interfere with the health of that critical organ. He started treatment with us. I just met him Friday. He's mapped out to commence therapy. So for him, we've been able to get him off the hormones, getting the blood flow to his genitals, and treat him with the goal, most likely, of curing him. I'll tell you over the years, but our success rate based upon thousands of other patients is about 95%. This is Dr. Lederman from Radiosurgery New York. We have lots of experience treating new or recurrent cancers. We were the first in New York to do brain radiosurgery, which is pinpoint treatment to treat benign tumors like meningiomas, pituitary tumors, or acoustic neuromas. We have the world's largest experience treating acoustic neuromas with fractionated stereotactic radiosurgery. We're happy to speak to you about that. We're the first in America with treatment for body cancers using stereotactic body radiosurgery. We have a booklet and DVD, which we're happy to send to you. Just call us during the work week, Monday through Friday, 9 to 5, and we'll put a package in the mail to you about all our work and a DVD showing you pictures and illustrations and discussions. And we also have now a new MP3 disc with 70 radio shows. So if you have trouble sleeping, just give us a call, or better yet, for the disc, come into our office. We're at 1384 Broadway, so we know there's 50 million people in Times Square every year. So if you have trouble sleeping, get this disc with 70 top radio shows. This is Dr. Lederman. We'll be back at 9 o'clock tonight on WOR Radio. If you have medical questions during the day, please give us a call at 212-CHOICES. Thank you for tuning in. God bless you and have a great day. Bye now.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. That's Dr. Lederman, the radiosurgery pioneer's goal, too. Dr. Lederman is first in America, first in New York, first for you with body radiosurgery. Dr. Lederman hits your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
You've been listening to a podcast from News Talk Radio 710 WOR. 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 WOR.